I've been the Minister of Health here in British Columbia since November in 2024. Pretty much around the world are experiencing a shortage of healthcare workers, be it physicians, nurses, but many other kinds of healthcare workers as well.
Would you mind just kind of telling us about the policy about U.S. physician recruitment?
We are taking every step that we can to increase and strengthen the healthcare workforce here in BC.
Honorable Josie Osborne chaired the Alberni-Clayoquot Regional Hospital District for 4 years and sat on the Alberni-Clayoquot Health Network for 6 years.
She was appointed the Minister of Health of British Columbia in November 2024.
So what prompted this policy shift?
Sometimes, something becomes urgent. It's when you really take a careful look at something and say, do we really need to have all of the process in place that we do? And can we make this simpler and faster? Of course, the public interest and patient safety is utmost, and we never want to compromise that. And it is quite simple. Right now, you go to the website, the portal, which is bchealthcareers.ca, and you register through there. You can register for an upcoming Team BC webinar, and we'll be hosting those in May. You'll get a lot of great information about our health system there, learn specifically about those job opportunities, and we can connect interested physicians with a navigator at HealthMatchBC.
So how many physicians are you hoping to recruit? How many positions are available?
Honestly, we are just hoping to recruit as many as we can.
How would doctors and their families obtain the right to live and work in British Columbia?
The BC government administers an economic immigration program that's called the BC Provincial Nominee program.
So what kind of physicians are you recruiting?
I mean, anybody is welcome, I have to say. That's why working with the college to enable U.S. trained doctors, and particularly those who hold certification with the American Board of Medical Specialties, make it really easy for them to become fully licensed here in BC without the need for further assessment and examination, taking more exams or training, or that kind of proof piece, that we could make this simpler and faster for doctors and nurses and others. And that's exactly what we're doing. British Columbia is a wonderful, warm, welcoming place to live. I think the values behind our healthcare system here really match the values of why people choose to go into medicine and to serve communities, to serve people. And we are ready, willing, and able to welcome. We are removing all the barriers that we can to make it easy for people to come here to British Columbia.
If you're a doctor and you're thinking about making a change in your life and your practice, trying something new, check out my latest episode of the Interesting MD podcast, where I interview the Health Minister of British Columbia, Josie Osborne, where she lays out her policies for making it easier for doctors who are trained in the United States to get their licenses in British Columbia. Check it out on the Interesting MD podcast.